The copay structure will remain the same for 2014. As a reminder, our primary care office visit copay will not apply for one visit per calendar year for adult routine preventive services, including annual routine physical exams, eye exams, and gynecology exams. Deductibles in the marketplace are typically at $500 per year for single in-network coverage and $1,000 per year for out-of-network coverage. Family deductibles are $1,000 or more per year for in-network and $2,000 per year for out-of-network. The MCW Tier 1 deductibles are well below the market average at $200 per year for single and $600 per year for family coverage. As illustrated at the bottom of this slide, you'll see that Tier 2 and 3 deductibles will increase slightly for 2014. MCW will continue to offer our 3-tier provider network, allowing employees to select the provider of their choice. This plan design continues to encourage our employees and their families to stay within the MCW network. Our data shows that over 92% of our employees seek care in Tier 1. New in 2014 will be the addition of coinsurance to our Tier 1 level of coverage. Single participants will continue to pay a $200 deductible, and family participants will pay a $600 deductible. After the deductible, participants will pay 10% of the additional service costs beyond the deductible to an out-of-pocket maximum as listed above. MCW will pay the remaining 90% of the cost of services. Our market data indicates that 83% of large employers have a health plan with a deductible and coinsurance. Coinsurance, or the percent of cost passed on to the employees, is listed above and is typically 20% of the cost of services for in-network and 30 to 40% for out-of-network services per year. The coinsurance percentages for all 3 tiers are listed in the center portion of this slide. As a reminder, Tier 2 provides coverage outside of the MCW service area, both throughout the state of Wisconsin and nationwide, and Tier 3 provides coverage for out-of-network, non-contracted services. Deductibles and coinsurance are new to us at the Medical College in our Tier 1 network. In this example, there are $2,275 in charges for services obtained by a Tier 1 network provider. In this example, you would pay the $50 specialist office copay for each visit. The deductible continues to be $200 per individual participant, so you would next pay the first $200 of your expenses, bringing the total to $2,025. You would just pay 10% of the remaining charges up to the maximum out-of-pocket cost, which is $400 per individual. In this example, you would have an out-of-pocket cost of $450 and will have met the annual deductible, coinsurance, and maximum out-of-pocket costs for the year. It is important to remember, copays will continue to be charged as they do not apply to the maximum out-of-pocket costs. New for 2014, MCW will require pre-certification of certain non-urgent MRI and CT exams. Our cost and utilization is well above benchmarks for both MRI and CT scanning in both the hospital outpatient and office-based settings, suggesting significant opportunity for improvement. This slide illustrates the current utilization of potentially avoidable high-cost imaging procedures versus benchmarks from the advisory board company. This shows MCW health plan participants were provided 78 MRI scans per 1,000 versus the benchmark that had 10 MRI scans per 1,000 that were potentially avoidable. The data also shows that MCW health plan participants were provided 61 CT scans per 1,000 versus the benchmark that had 15 CT scans per 1,000 that were potentially avoidable. MCW is spending nearly $2 million annually for these additional high-cost imaging procedures. New in 2014, we will require pre-certification process for certain non-emergency MRI and CT scans ordered for headaches, migraines, back pain, pain in joints, pain in limb, abdominal pain, and possibly others. Please have your provider contact the phone number on your new medical ID card that will be mailed to you in December. Our health plan requires pre-certification for services for inpatient hospitalization at least 7 days prior to a planned hospital admission. Urgent or unplanned admissions must be certified within 48 hours after admission or the next business day, whichever applies. Note that in addition to hospital admissions, plan pre-certification of services is required for organ transplant treatments, genetic testing, bariatric surgery services. Failure to follow these pre-certification or notification requirements will result in a $100 penalty. The penalty does not apply to maternity stays and is waived for services provided outside of the U.S. The phone number to use for pre-certification and notification is conveniently provided on your CoreSource ID card. Our health plan Tier 1 network now includes our Community Physicians Group, Community Memorial Hospital, St. Joe's West Bend Hospital, and the West Bend Clinics, with the exception of the ancillary providers to include emergency, lab, radiology, and anesthesiology. These services are provided by contract physician groups that are in our Tier 2. MCW will continue to use the Trilogy Health Insurance Network for coverage in Wisconsin and MultiPlan Network for Tier 2 providers who are located outside of Wisconsin. Express Scripts will continue as our pharmacy benefits manager in 2014. Express Scripts has a full network of pharmacies across the nation that includes Walgreens, CVS, Froedtert, and many other local retail pharmacies. MCW encourages the use of the Express Scripts mail order program and provides a 90-day supply for 2 copays. MCW also provides a 90-day at retail option for 2 copays only at Froedtert, Walgreens, and CVS retail pharmacies. In 2014, our pharmacy formulary will restrict ulcer medications to generic only. We have found that there are a wide variety of both over-the-counter and generic medications available that will save you and the health plan money. A great example of how much we can save is with Nexium. A 30-day supply of Nexium, if a patient is taking 2 pills per day, is $400, and the generic is $18 for the same 30-day supply. Additionally, all new specialty medications prescribed after January 1, 2014 will require a prior authorization from Express Scripts. All new patients will be required to use a lower-cost alternative medication before a specialty medication will be approved for coverage. Specialty medications account for a growing percentage of our costs, and our cost is almost $10 more per member per month than the benchmark. Our prescription copays will remain the same in 2014. Copays for Tier 1 generic medications will stay the same at $10 retail, $20 for a 90-day mail order supply. For Tier 2, preferred brand medications will remain the same at $25 retail and $50 for a 90-day mail order supply. Copays for Tier 3 non-preferred brand medications will remain the same at $60 retail and $120 for a 90-day mail order supply. The copay for Tier 4 specialty medications will also stay the same. These medications will be $110 for a 1-month supply. These medications are not available in 90-day supply amounts. MCW continues to promote the use of generic medications, and generic incentives will continue in 2014, whereby higher costs will be passed along to participants who choose a brand name drug when a generic equivalent is available. The member will be required to pay both the brand name copay amount and the difference in cost between the brand and generic drug. The generic step therapy program is designed exclusively for people who have certain conditions, such as arthritis, high blood pressure, and high cholesterol, for example, that require them to take medications regularly. Step therapy drugs are grouped in categories based on cost and effectiveness. Step 1 frontline drugs are generics. They have been FDA approved as safe and effective and should be tried first because in most cases they will provide the same health benefit at a lower cost. Step 2 backup drugs are the brand name drugs you see advertised on TV and in magazines, and these drugs typically cost more than frontline drugs. The Drug Quantity Management Program aligns prescription medication dispensing quantities with FDA-approved dosage guidelines and ensures that the most cost-effective product strength is prescribed. In 2014, the Health Flexible Spending Account limit of $2,500 will continue to be the annual maximum election amount available. 2 spouses who work at the same organization can each make separate $2,500 elections. Remember that any funds you contribute to a health FSA are subject to the use it or lose it forfeiture rule, and that you must obtain a prescription for any over-the-counter items you purchase and submit for reimbursement under this plan. Health flexible spending accounts can provide a real savings to employees. This example illustrates the benefits of setting aside $1,500 into a health flexible spending account. The health flexible spending dollars are available beginning January 1 of each year and can assist with covering eligible expenses immediately. In this illustration, the employee that earns $35,000 will save $460 by paying for health expenses with pre-tax dollars. Actual savings will vary based on your individual tax situation. Please consult a tax professional for more information.